Hi, welcome back to NurseEdScholar. So, this video is going to be talking about isolation precautions, and I'm going to try to make it as easy as possible. And then I'm gonna have, some subsequent videos to kind of clarify, just a little more deeper dive. But I think this video will do a really good job for you and help you with studying for exams and NCLEX, and really getting a grasp around, what are really isolation precautions and what is really going on. And so, I want you to know that isolation precautions are one of the most overcomplicated topics in nursing school. I think that I guess I don't know why they make things so complicated. And students memorize random charts, and so memorizing and not understanding, they panic during the NCLEX questions, they freeze up, especially when they see questions like which patient should be placed in a negative pressure room or which PPE should the nurse wear first. Okay. But today, I'm going to simplify the entire topic. And so hopefully by the end of this video, you'll understand airborne precautions, droplet precautions, contact precautions, PPE requirements, negative pressure rooms, transportation rules with patients, room assignments, how do you assign your rooms, and and some NCLEX tricks. I hate to say trick because in nursing school we're really not trying to confuse you. We just want to make sure that you understand the information. And so, I'm not just going to tell you what to memorize. I'm going to really explain why these precautions exist physiologically so you can think like a nurse should instead of memorizing like a robot. Okay? So, let's begin. Let's begin. So grab your notebook because this is one of those videos that you'll probably rewatch in the future, especially preparing for your exams and for NCLEX. So let's start. Okay, so what are you going to learn? Like I said, what's the difference between airborne, droplet, and contact precautions? Understand why precautions are required, identify, the PPE, room assignments, and some NCLEX traps. Okay, so when you're looking at isolation, you really have to understand the science behind it. Because once you understand that and how infections spread, the precautions start making sense. And that's what we're doing here. So, let's kind of understand it. So, infection transmission happens through movement. Okay. Microorganisms move. They move through the air, through the respiratory droplets, through touch, direct touch, and through contaminated surfaces. Okay, so let's look at it. And the size of the microorganisms and the organisms or the particles, they matter tremendously. The key thing I think that students miss is the fact that, tiny particles, they behave differently than larger ones. Okay. Um, some particles, your tiny particles, stay suspended in the air for hours. Okay. And then other particles, the larger ones, they drop to the ground within seconds. And knowing these things will determine the room type the patient goes in, the mask type, their PPE, and patient placement. All righty. So let's kind of get started with the precautions. So airborne precautions. Airborne precautions are used for infections caused by very small particles. These particles are tiny enough to remain suspended in the air for long periods of time. And what that actually means is that, the infection can actually float throughout the air. And this is why airborne diseases are so dangerous. The particles can travel farther, they linger longer in the air, and they infect more people. So think about it. Think about like, you know, you're at your house and it's dark, I guess, on the inside, and you're looking through the window and the sun is shining and you can see the air particles in the air. Airborne organisms behave similarly. The particles are generally less than, I guess, 5 microns in size. And so because they're so small, gravity doesn't pull them down. The air kind of carries them. And they can enter deep into the lungs. And, you know, deep lung penetration is really important. And diseases like tuberculosis infect the alveoli. And the bacteria, it reaches the lower respiratory tract and it triggers inflammation inside the lungs themselves. And this is why, airborne diseases often cause severe respiratory compromise. And on the NCLEX, the big airborne diseases are tuberculosis, measles, and varicella. Now, students often memorize this as MTV, measles, tuberculosis, and varicella. And this memory trick is fine, it's good, but understanding why matters more than anything. And so when you're looking at airborne precautions, remember that the patient is going to require a private room. And why? Because we don't want to contaminate the air escaping into the hallway. Remember, the air particles are small, they can float, they stay suspended in the air a very long time. And because of it, it can infect more people. And so that's why negative pressure rooms are really important because they pull air into the room instead of it allowing it to contaminate, out in the hallways. Okay, hopefully that kind of makes sense what I'm saying. And I'm going to talk more about it. When we talk about negative pressure rooms, I think this concept is misunderstood. Negative pressure means that the pressure inside of the room is lower than outside of the room. And so kind of think of it like, when you're thinking of fluids and figuring out which fluid kind of pulls things into the cell and pull things out. Well, it's kind of the same thing. With negative pressure, the air naturally flows towards the lower pressure. So in a negative pressure room, that air is lower pressure. So the clean hallway air gets pulled inside the room, into the room, and the contaminated air doesn't flow upward. And so then, the negative pressure rooms have this kind of specialized ventilation and it filters the air before it's released. And this prevents the airborne particles from spreading throughout the hospital. So let's talk about this one more quick time. The negative pressure room, the air in the room is lower than outside in the hallway. So the clean air from the hallway is pulled inside of the negative pressure room. And because the air in the negative pressure room is lower, that contaminated air stays in the room. It goes through this specialized ventilation filter, and then it's released. So hopefully that cleared that up. Now, when you're talking about PPE requirements for airborne organisms and airborne precautions, the nurse is going to wear an N95 mask, not a surgical mask. Students may mix this up. A surgical mask protects against large droplets, large, particles, where an N95 protects against tiny airborne particles. And so let's think about it. The N95. You'll learn that when you go to work, they perform a fit test and they make it tight enough to seal around the nose and the mouth. And why does that matter? It matters so airborne particles, they're so tiny. If you have an improper fitted mask or a surgical mask, it just sneaks around the gaps and it'll get into your respiratory system. And if your mask, like I said, if it doesn't seal properly, you will or you can inhale the contaminated particles. And that's why fit testing matters. So when you hear about fit testing, that is what that means. Okay, so let's look at a question. So a nurse is caring for a patient with active tuberculosis. What action requires intervention? So the patient is placed in a negative pressure room. B, the nurse wears an N95 respirator or mask. C, the patient wears a surgical mask during transport. And D, the nurse wears sterile gloves when entering the room. So which one of those do you think requires intervention? So the answer is D. Sterile gloves. Sterile gloves are not required for airborne precautions. And let's think about why. Tuberculosis spreads through airborne inhalation. So the major risk is inhaling the infectious particles into the respiratory tract. This is not a contact, not contact transmission disease. So protecting the airway matters most. And so let's look at the other correct answers. Negative pressure rooms protects the hospital environment. So the patient is going to be placed in a negative pressure room. The N95 protects the nurse's respiratory tract. So the nurse wears an N95. We talked about that seal that prevents those tiny particles from getting into the nurse's respiratory tract. And C, the surgical mask is worn by the patient. Okay. Now, the reason why the patient wears a mask is because they wear a mask. They don't have to wear an N95 mask, but a surgical mask during transport so they don't spread the particles throughout the hospital. And and before I move on to Droplet, I forgot to say one thing. You know, understand that the NCLEX likes to make things seem super safe, extra safe. And so sometimes students get tripped up if they're kind of confused because they say, ooh, you know, sterile gloves, that's the best thing. But with airborne precautions, like I'm saying, it's you don't need, sterile gloves. And so I just want you to know that because the NCLEX really um I hate to say trick, but it will, see if a student really understands the information. Okay. All right. So let's move on to droplet precautions. Now, droplet precautions involve larger respiratory particles. The particles are heavier than airborne particles. And so, because they're heavier, they fall to the ground faster. So, usually within 3 to 6 feet. Think about it. When someone coughs, sneezes, talks, or even breathes heavily, the droplets contain microorganisms. And because the droplets are larger, gravity pulls them down faster. And that means that they don't remain suspended in the air for longer periods of time, like the airborne particles. And so common uh, droplets diseases would be like influenza, meningitis, pertussis, RSV, COVID, mumps and rubella. And so if you're familiar with some of them, notice that they're upper respiratory infections. Now for PPE precaution, for droplet precautions, the nurse is going to wear a surgical mask, not an N95, unless it's specifically required if the doctor orders it. And why? Because the droplets are larger, they fall faster, they don't remain suspended long enough in the air that would require a specialized respiratory filtration, like that negative pressure room. Okay. And for droplet precautions, you may see an order for a private room. Okay. But not a negative pressure room. It's not required. And that's a huge distinction on the NCLEX. So if you see like a question that says, uh, is in a negative pressure room, the nurse is wearing an N95, or there's some kind of airborne ventilation system, the answer is probably airborne precautions. And that's one of the biggest clues to those types of questions. So let's move on to another question. A nurse is assigned 4 patients, and which patient should the nurse see first? So this is a prioritization question. Um, Patient with influenza, coughing without a mask, patient with TB, wearing an N95, patient with MRSA, waiting for antibiotics, and a patient with varicella asking for pain medication. And so the answer is A. Like I said, this is a prioritization and a transmission question. And the influenza patient um, that is actively coughing and creating all these infectious droplets, into the environment, that is the one that the nurse is going to see first because the influenza patient is the one that poses the greatest risk to staff, to visitors, to other patients. And so let's look at each one of the options. So remember, there was a TB patient. The TB patient was already wearing respiratory protection. Okay, so that's not somebody you would see first. The MRSA patient, that's actually a contact precaution, not an airborne, and they needed antibiotics. But the transmission risk is lower than an uncontrolled respiratory spread, like that influenza patient coughing. And the varicella patient, yes, that's an airborne, but they needed symptom management by asking for the pain medicine. But understand there was nowhere in the context that noted that there was immediate uncontrolled exposure. It's not there. So a lot of students tend to add to questions and add to the stem of the question. And so please, try your best not to do that. Um, Teachers give you what you need, when you're trying to figure out the correct answers. And so, know that the NCLEX prioritization often focuses on immediate safety risk, uncontrolled transmission, and who threatens the largest number of people. And that is typically that'll be the first person that you would see. Okay, moving on to contact precautions. Um, Contact precautions involves transmission through direct touch, indirect touch, or contaminated surfaces. Remember, that many organisms survive on surfaces in the hospital. You got your bed rails, that's notorious. Blood pressure cuffs, most students don't even think about that. Stethoscopes, that's why you should clean them after you leave in every patient's room. Door handles, sheets on the bed, because you have to think about some organism lasts for days. They survive for days. And this is why environmental cleaning matters so much in the hospital. And so common contact diseases uh, that you'll see in testing are MRSA, VRE, C. difficile, RSV in infants, and wound infections. And note C. diff or C. difficile. C. diff is extremely important for the NCLEX. You will probably hear more about C. diff than a lot of the um, other disease processes because it's more common and it spreads quickly. And then also, I guess it depends on what part of the country or the world you live in and what's common in your area. But C. diff is big on the NCLEX. So because it's big on the NCLEX, let's talk about it for a second. C. diff forms spores, and spores are incredibly resistant. The normal, how you can use alcohol-based sanitizer on your hand, it's not reliable to kill spores. And that's why hand washing with regular soap and water is required. It's the best thing. One thing about C. diff is that it infects the colon. Um, it releases toxins that damage the intestinal tissue. And C. diff will cause inflammation, severe diarrhea, fluid loss, cause electrolyte imbalances, and potentially toxic megacolon, which will kill your patient. So, the spores spread easily through stool, and that's why environmental contamination becomes such a major issue in the hospital. It is a major issue if your patient has C. diff. And so, what kind of PPE would you need? Well, gown, gloves, dedicated equipment for the patient because you don't want to bring, how in the hospital, and if you haven't started nursing school yet, the patient care techs or even the nurses, they'll go through room to room and take vital signs, right? And they use a machine, a Dynamap typically, or that's a common brand, but a Dynamap. And so if you're bringing that from room to room and you have a patient that has C. diff, it's a chance that that will, for some kind, it happens, get contaminated and you're moving and spreading the disease throughout the hospital. So the patients will have their own dedicated equipment just for them to reduce that chance of contaminating others. And so the focus is on preventing organism transfer through touch. So let's look at an NCLEX question. The nurse exits the room of a patient with C. diff. Which action requires intervention? Removing gloves before exiting, washing hands with soap and water, using alcohol-based sanitizer only, and cleaning shared equipment. Which action requires intervention? So the answer is C. Alcohol sanitizer alone is insufficient. And why? And we talked about it. Spores are resistant to alcohol. Um, this is kind of a microbiology concept that students often memorize without really understanding. Spores develop like a protective outer layer, and it's really resistant to any kind of destruction. And soap and water physically removes the spores from the hands. And that physical removal matters. Okay. So let's look at the other responses. Gloves should be removed carefully to avoid a contamination. So, yes, the nurse is exiting the room. Yes, they should be removing their gloves, throwing them away, washing their hands, and exiting the room. Soap and water is correct. They're supposed to wash their hands after they take off their gloves before they exit the patient room. And cleaning equipment prevents indirect transmission. Yes, you want to make sure that you clean all of the equipment well because you want to try to reduce indirect as much indirect transmission as possible. And this is why C. diff outbreaks spread so rapidly in healthcare facilities. The organism survives extremely well. Okay, and that's why it is so important to make sure that we do our due diligence when we're taking care of our patients and following the precautions because we really want to prevent others from becoming infected as well. So let's just kind of simply break down everything. So I have a chart here. So airborne particles, they're tiny particles floating in the air. So the patient needs to be in a negative pressure room. The nurse needs to wear an N95. And the common diseases are tuberculosis, uh, measles, and varicella. For droplets, there are larger respiratory droplets. So the nurse is going to need a surgical mask. Private room is definitely preferred. The diseases associated with droplet precautions are influenza, meningitis, and RSV. And remember, with these droplet precautions to stay 3 to 6 feet away. And with contact, touch transmission, gown, gloves. You're going to need dedicated equipment for these individuals. Private room is definitely preferred. You will more than likely see a private room on patients with especially C. diff. But um, it's preferred for contact precautions for individuals with MRSA or VRE. Even though they say C. diff, like I just said, more than likely that patient will be in a private room. All right. Now, room assignments, you know, the goal is you want to protect the most vulnerable patient from the most contagious patient. And that's really what that's all about. You never really want to place an immunocompromised patient near an infection. You don't want to put airborne precaution patients with non-airborne, and you don't want to put a contagious patient with C. diff with a vulnerable patient or an immunocompromised patient. And so that's basically how they determine room assignments. So that's why it's very important for the charge nurse to know what each and every patient has. So when they are making room assignments, they are able to make sure that they don't put the wrong individuals together. Now, a lot of hospitals are going and now they're trying to make more private rooms because of this. But if a lot of hospitals probably still have two people in a room, and so this is where room assignments are very important. All right, we have a question. Let's see. So, which roommate assignment requires intervention? We have an MRSA with another MRSA. That's A. B is influenza with influenza. C is a neutropenic patient with a patient with C. diff, and an RSV infant with another RSV infant. Oh, I didn't even see that misspelling. I apologize. But D is RSV patient infant with another RSV infant. And this one is pretty easy, but it's just to get you to understand, you know, what can be done. It is okay to put two people with similar conditions together. It's just making sure that you are protecting the sickest patient from, or the most immunocompromised patient to the one that can, I guess, cause the most damage to that patient. I guess that's the best way to say it. And so the answer is the neutropenic patient. You don't want the neutropenic patient with someone who has a severe infection because they have a severely weakened immune system. Their defense is not good. And even minor infections can become life-threatening to a neutropenic patient. And C. difficile or C. diff creates a high environmental contamination risk. So you definitely would not want to put that patient with an immunocompromised patient. And I just wanted to throw this in because this is why. I mean, and we talked about it. Neutropenic patients, they lack adequate white blood cell production. And so this means that they have a poor immune response, reduced infection fighting, and they're at increased risk for sepsis. And so placing them near an infectious person, especially someone with infectious diarrhea, dramatically increases the danger. And the NCLEX loves using immunocompromised patient questions because these patients are extremely vulnerable. And this is something that you really need to know. Alrighty, so before we finish, let's kind of review again. So, airborne precautions, remember tiny particles, negative pressure, and the nurse wears the N95. Droplet, there are larger respiratory droplets. The nurse wears a surgical mask and they should be 3 to 6 feet apart. Contact, touch transmission. You want to make sure that the PPE is gloves and gowns and that patient has dedicated equipment. And some NCLEX tricks that you can use. C. diff, soap and water only. I hate to say only, but really for this one, that's the best is soap and water for C. diff. Um, Tuberculosis is airborne, so because airborne floats. Influenza is droplet. Droplets fall fast. Uh, MRSA would be contact. And then remember, MTV is measles, tuberculosis, varicella, and um, they all need airborne precautions. And so that's it. If this video finally helped isolation precautions make sense, make sure that you subscribe to NurseEdScholar, hit that like button, turn your notifications on. My goal with NurseEdScholar is to build one of the strongest NCLEX clinical judgment libraries on YouTube, and that is my goal. I want you to remember to you just don't want to memorize. I really want you to understand nursing because understanding, and I tell my students this all the time, understanding helps you answer difficult NCLEX questions. When the wording changes, a lot of students want, what I'm studying or what I'm reviewing in an NCLEX book. I want that to be exactly what's on the test, and that will not happen. But if you understand the process, then it doesn't matter what words they tell you because you'll be able to get it correct. So drop a comment. Let me know what you'd like to see next. My next is going to be PPE sequence and NCLEX quick tricks to help you understand. And so I'll see you in the next lesson. Happy studying from Nurse Ed Scholar.